Good morning, everybody. I want to go ahead and call the meeting to order. This is the Health Subcommittee of Appropriations. House Bill 669 has been assigned to our subcommittee, and Minority Leader Trammell has requested a hearing on that bill, and we're here today to hear from him and listen to him, whatever comments he would like to make, and have members of the committee any questions or comments that they would like to make too. So at this time, we're going to recognize Leader Trammell to present House Bill 669. And Bob, you want to just come to the podium over there? First, now, before you start to present your bill, we want to get a update on the newest Trammell. Did you get a lot of sleep at home last night with number 3? Or
Mr. Chairman, at 6 days old, you know, we get about an hour of uninterrupted sleep at a time. That's
it'll get better. Go.
Thank you, Mr. Chairman and members of the committee. First, I want to say I appreciate the time and attention of this committee and of my colleagues on this issue. I present to you House Bill 669, a strategy to leverage dollars Georgia taxpayers are currently sending to Washington, D.C., and help put an insurance card in the pocket of all Georgians. This bill is very simple, but would provide a powerful economic booster shot to our rural communities. House Bill 669 would help Georgians afford health insurance, adding more residents to our health insurance rolls in Georgia. These individuals are veterans, working parents, farmers, self-employed, small businesses, and others. Over the years, I've heard from many Georgians on this issue. It is rare that I give a talk about closing the coverage gap in Georgia that I do not have someone from the audience come and tell me that they fall into that gap. From individuals to provider associations such as the American College of Physicians, to the economic generators of our rural communities, such as the Georgia Alliance of Community Hospitals, to organizations on the front lines of health crises such as Mental Health America and the American Cancer Society. Even the Georgia Chamber of Commerce has expressed support for a solution that will help address the problem of rural health care by helping Georgia reclaim the dollars we are sending to Washington to fund health care coverage in other states. According to the Georgia Chamber, they estimate that nearly 25% of Georgians in rural areas will be uninsured by the year 2026. And that's why I'm here today to speak about House Bill 669. House Bill 669 accomplishes 3 goals. First, it would bolster economic activity across Georgia with an outsized impact on rural communities and anchor businesses in those areas. Second, it would move us beyond the patchwork approach to rural health care to a comprehensive solution to help more Georgians get an insurance card so they can go into the market and buy health insurance. And third, it would leverage those state dollars currently going to Washington, D.C. to help put insurance cards in the pockets of hundreds of thousands of working Georgians. According to the Georgia Hospital Association, every 1 hospital job in Georgia creates 2 jobs in the surrounding community. In many rural communities, the hospital is the anchor employer, if not the largest employer in the area. While some of the health care bills we have been debating this session will do some to help, they are largely Band-Aid proposals that are not going to get us where we need to go. Why are we regarding hospitals as the generators of economic activity that they are? Last week, Monty Veazey with the Georgia Alliance of Community Hospitals told NPR, if you want to save rural hospitals, you got to do Medicaid expansion. That's the only thing that's going to help rural hospitals survive. Increasing the number of paying customers is the #1 way to improve the financial condition of rural hospitals by ensuring they are actually paid for the services they are delivering. House Bill 669 will result in a drop in uncompensated care costs, bringing new dollars to rural hospitals. In Arkansas, the state saw a 56% decrease in uncompensated care costs in the first 6 months of closing the coverage gap. In Kentucky, nearly 60%. Closing the coverage gap would also mean reclaiming the millions of dollars a day Georgia is missing out on. it's about $8 million a day. Any business person worth their salt will tell you that a 9-to-1 match on an investment is a heck of a deal. House Bill 669 would allow Georgia to leverage a match of $9 in federal funds for every $1 in state money, bringing in roughly $3 billion with a B dollars in federal funds each year. Georgia's current Medicaid program runs on a 2/3 match. We get 68 cents in federal money for every 32 cents in state money. We run our state like a business, and this seems like an obvious business case. As taxpayers, Georgians have already invested in closing the coverage gap nationwide. If we don't accept this opportunity in Georgia, the federal government keeps our tax dollars and they go to other states. Meanwhile, those who have sent us to Atlanta will continue to pay the price. House Bill 669 puts an insurance card in the pockets of hundreds of thousands of Georgians, bolsters our rural communities for the long term, allows Georgia to reclaim hundreds of millions of dollars we are sending to Washington, D.C., and specifically, we are sending $8 million to Washington, D.C. every day that could be returned to Georgia for Medicaid expansion. We can also provide access to affordable insurance so that individuals can get the treatment, access, and care they need to be productive citizens. It would also reduce the challenges of medical debt and bankruptcies that many Georgia families unfortunately face. Let me close with this. The substance abuse crisis in our state is alarming, as it is across the country. Your zip code should not determine whether or not you have access to treatment to fight that addiction. And right now, in too many cases, it unfortunately does. Our rural healthcare system and high rates of uninsured residents is a recipe for disaster. It means folks that live around metropolitan areas like Atlanta usually have access to services and clinics. But in rural Georgia, all too many times, that is simply, unfortunately, not the case. The evidence is there. House Bill 669 is a frontline approach to combat all the big issues we debate down here: rural economic development, opioid abuse, mental health, and making efficient and cost-effective use of state dollars and investment. Mr. Chairman, members of the committee, I thank you for your time, and I respectfully request your support of House Bill 669, and happy to answer any questions.
Okay, thank you for your presentation. Are there any questions or comments from members of the committee? I know, yeah. Hit your button there so I can. Okay, try that.
Mr. Chairman and members of the committee, and to the author, thank you for bringing this to us. This really is common sense economics for our state, and hopefully we will grow to come to the realization at some point that we need to do this for our citizens, not only to prevent additional hospital closures, but to help spur economic development or help stem the tide of job losses in our rural communities, and to make sure that our citizens have the access that they need. So I appreciate your continuing in this effort, and we'll see where it goes. We'll see where it goes. I think that eventually we will come to this realization, and I don't know how long that eventually is, but I think we will get there. And thank you for keeping it ever before us.
I thank you for your comment and your partnership in this endeavor, and you know, I would note 32 states have opted to accept the funds available under the Affordable Care Act to cover citizens. You know, just this year in the state of Virginia, they've taken up this debate and have seen it prudent to endeavor to avail themselves of the federal funds. So I'm confident that we'll continue to talk about this issue, and hopeful that we'll make more progress on it.
Thank you very much, Mr. Chairman. Just last week, I did a poll in the district that I represent, House District 57, which is entirely in the city of Atlanta, a fairly urban area. The #1 issue of the constituents in the 57th district was Medicaid expansion. Some of these are people who whose children actually are on Medicaid, and have respect for the system that they currently use and wonder why, as working adults, that same system is not available to them. I have a hard time answering that question because I think if parents get health care, the children will benefit in many ways. I know everybody on this committee has heard me for years complain about why we're not doing more. $1 invested bringing $9 back seems like the kind of investment we'd all like to have. The question I wanted to ask you, Mr. Leader, is whether or not you've done any research on the mental health system. When I first started looking into this, I tried to get mental health system to add up all the state dollars that were spent on adults who were seriously mentally ill, because very few federal dollars were available to them. And there are never enough dollars in our state mental health system to deal with those people, particularly in Fulton County, where we have a different system. So I wonder if you have any statistics on the cost offset that would result in federal dollars, 9 times as many federal dollars as we are currently receiving for treatment of adults with mental illness.
So,
I'm sorry I didn't set you up for this question.
No, thank you for
an answer.
thank you for the softball. I don't have those statistics readily available in front of me, Mr. Chairman. There may be experts. I think there are some who may be able to speak to that in the audience. I don't know if that would be appropriate to take that question. But one ask that I would have of this committee and of the General Assembly generally is that at this stage in the legislative session, obviously we're not in a posture to do this year. But one thing that would be tremendously helpful is if we could have a study of the type of savings that we could experience, just like you're talking about in the mental health context and others. The fiscal note that we have makes reference to some, and there's publicly available information on savings that other states have experienced in the budget in departments like the corrections department, where they've been able to move people over to the Medicaid expansion match, and that would just be tremendously helpful in allowing us to see the full benefit of this program.
At one point, I think I added up at least $400 million that were purely state dollars that could have been matched by a Medicaid expansion. So it is still baffling to me why many states, both red and blue states, seem to be able to understand that math. And I, as a taxpayer in Georgia, my taxes have not gone down because we're not doing this. So let's hope over the summer and over the next period, we will find some ways to make a program work for Georgia that will allow these adults to get the health care they so desperately need and help our rural hospitals that we are all extremely concerned about. But thank you very much for your presentation.
So if I could just say one thing, even though we may not have the statistics on what the savings would be as a line item, for our budget process, there is a real cost to people going without treatment.
Absolutely.
Both in the mental health context and in the substance abuse context. That is a social cost, it is a real economic cost, where we are expending money in other line items that we could save if people could just afford to get treatment.
Thank you for your presentation, and thank you for your service to the state.
Thank you.
Although we're on sort of opposite sides of the aisle, I have a great respect for you and a lot of your colleagues. And being a healthcare provider, I'm very interested in this subject, obviously. I guess that, I have been looking at this for years, and I still have trouble coming to grips of the cost to the state and the costs that are not seen on the front end and what's obvious on the surface. We've been looking at this, and it's going to take, frankly, it's going to take some more time looking at it, and I know that's not what anybody wants to hear. But at the end of the day, Medicaid's paying hospitals about 80%. If we convert everything out there into Medicaid, which was some thought out of Washington years ago, our hospitals would still fail because the federal government's not really paying the freight. They say they're going to take care of health care, but at the end of the day, they don't pay for all of health care. They leave the state paying on an FMAP about 34, 36 cents, depending on their poverty level. I think there's somewhere in here we need to find a way to take care of people that need health care, and the emergency room is not the only way and shouldn't be the only way we do it. You know, you have healthcare groups like the Georgia Dental Association, Georgia Medical Association, and community hospitals and community groups of providers, physicians, and dentists. Volunteering at free clinics and doing that and seeing patients in their offices at no charge and doing all the things we can do. And, you know, I think there's some ways to even look at that. We've been grappling for years of how do we give them a tax deduction for doing that, and we haven't come up with that either. So, you know, we're still struggling with this health care thing. The thing that does concern me is that many times when you look at the figures in the studies, they're comparing added childless adults to this group, and they say this is how much Medicaid costs. Often they're looking at the LIM population, which is low-income Medicaid, which is mainly children and pregnant women. And treating adults is more expensive than treating kids. I don't know where the true costs are going to be. You know, at the end of the day, we're all going to be paying the bill somewhere. We cannot put all this on hospitals and providers and think that charity is a payment system to them. And it's a harsh word to use. But again, until we really stand to the line and do what we say we're doing in providing health care and actually pay for it, that's how we provide it. So I appreciate what you're doing, and I look forward to working with you and trying to find a way through this.
Thank you. I look forward to working together on that. You know, the one thing I would say is that right now, with uncompensated care, as you've indicated, somebody pays the cost for that, right?
Right.
And private insurance premiums are higher as a consequence of uncompensated care. So the health care delivery system that we have for the uninsured in Georgia is unimaginably inefficient. And by providing a way to put an insurance card in those people's pocket has to help. And the benefit of this is that there's investment that we don't have to do the lift entirely with our own state tax dollars. And that's my interest, is the prospect of bringing that type of investment to Georgia to bear on a problem that we all know is there. Really is something that no matter what form it takes, we're open to exploring.
Right, and I agree. The thing I guess that we struggle with on the money side, especially with this committee, is that at the end of the day, Georgia's going to pay. We're a balanced bill state. I mean, you know, we can't borrow money. So no matter who shows up at the door, we're going to pay for them, and we've got to figure out exactly how we're going to do that. And that's a problem, as you well know.
Right. And the only other remark I would make to that, Representative, is the fiscal note analysis sort of lays out the cost case. And, its assumption when you look at it is, based upon the notion that there are roughly in excess of 600,000 Georgians who would benefit from Medicaid expansion. Well, that's a huge percentage of our state's population. And I think the number of uninsured residents in Georgia total is about 1.2 million. So just by doing this, we could cut our uninsured rate in half. As to where the funding comes from, the one thing that I would sort of, again, to go back to this concept of studying and an examination of what the impact would be in terms of funding source and the net savings and net effect of implementation of a program like this is it does not take into account the increase in provider fees that would be recognized by the type of investment that Medicaid expansion would bring. And that would help offset cost. In terms of, finding another source, and I'll just throw this out there for the consideration, this is obviously not the topic today, but we have the third lowest tobacco tax in the country, 37 cents. This seems like a natural area where we could find some funds to help pay and help make Georgia a healthier place for our residents. So I would just commend that as food for thought.
You've given, just about, you've given us some things to look at and to read and study. Look forward to working with you.
Thank you. Same here. Thank you.
Thank you very much, Mr. Chairman. I think the question we need to ask ourselves, each of us, whether we are Democrats or Republicans, is it going to be possible for the state itself, a state that has a very high level of poverty, to be able to provide adequate health care for our citizens? And I can't imagine that with the level of poverty that can be true. I read in the literature about hospitals in other states where Medicaid has been expanded that have thrived in this environment. And what we are asking our adults to do is, and even in the city of Atlanta, where there are plenty of hospitals and doctors and the resources are here, but people who don't have any insurance wait till they get really sick. They go to the emergency room and they cost 10 times as much, because rather than getting preventive care, they have waited too long. The hospitals end up footing the bill, and I think it's also not fair to the hospitals to expect them to come up with the answers to questions that we have not been able to take a very hard look at. So the question is, really for me, is the state going to be able to underwrite the cost of the healthcare needs in our state? And I am hopeful that we as Democrats and as Republicans can work together to come up with a plan in the next year to make the system work for Georgia. It's been 5 or 6 years that some states have been receiving significant federal funds. So to suggest that those funds are going to be discontinued is a little difficult for me to understand. I understand many of our programs are threatened with the rhetoric that's going on, but we have some hard work to do, and we have people who really need all kinds of healthcare services. So I hope, we're pretty representative on this committee of a mixture of Republicans and Democrats, or at least today. And I would urge us to take a very hard look at how we can manage this and whether state dollars are ever going to be enough. Thank you.
Thank you.
Mr. Chairman, it's more of a comment than a question, and it's basically to you. My ask, since this is just a hearing only and we're not going to take action today, my ask of you is that this committee look at the experience that other states have had. There have been several years now. There's data out there. There's experience. I understand that Georgia took a conservative point of view. We should be able to look at the experiences that are out there. There should be enough information for us to review this over the interim and maybe come up with a Georgia-based solution to the issues that we face, recognizing that Georgia is unique, but Georgia has always been able to forge ahead with the Georgia-based solutions to our problems. And I hope that we can commit to doing a really thorough look at what the possibilities are, take everything off the table and create a new table, and look forward to and forge ahead and see what we can do for our state.
Thank you. I think that's a good idea. And let me just remind you of a couple of things along that line, too, that if you'll remember in the amended budget, we placed $750,000 in there to do analysis of the Medicaid delivery system for the purposes of identifying efficiencies and service delivery improvement opportunities. That'll be matched with an additional $750,000 for $1.5 million, and that fits right in with what you're talking about, to look to see if there is a better way to do this. I want to make a couple of comments myself as we begin to wrap this up. I think that I know one thing. The more I know, the more I find out I don't know. And whoever was it that said this is a complicated issue, no fooling. It really is complicated. And I think we all want the citizens of our state to have access to health care. And I'd like to take a moment and just share a few things with you that this subcommittee, the Appropriations Committee, and the House has done and is doing to improve access to health care in our state. And I mentioned to you about the $750,000 in the amended budget. Chairman England and our top-notch House Budget and Research Office have given us a highlight sheet of House Bill 684. This is the FY19 budget, and many of you have seen this, but I want to just share just a few little things off there that I'm proud of, that this subcommittee and others made some recommendations, and they were included in the budget that we have passed in the House. So I think we can take pride in knowing that. There was $500,000 in there this year to startup grants for federally qualified health centers. These are centers that treat people regardless of their ability to pay, and to me, I call that a safety net for somebody who doesn't have anything. And we've done this over the past years. This wasn't something that we just started. We've been doing this for a while. There was $1.7 million in there to pay for new residency slots in primary care medicine. And you know, you think back on the governor's initiative when his goal was to create 400 new residency slots across this state, not just in the metro areas, but all across this state, to turn out more providers, more healthcare professionals, so that we can take care of the people in this state. In our budget, we passed $750,000 for new fellowships over at Augusta University at MCG. This would be where we can take some of our best and brightest and hopefully keep them in this state and provide health care. One of the things that I think we can really be proud about is the $2 million in the Department of Public Health for the maternal mortality program to try to do something with that. Georgia has the highest rate in the country, and that's something that none of us should be proud about. $150,000 in the Sickle Cell Foundation for the Sickle Cell Outreach Program. $75,000 to implement the diabetes prevention program in 5 counties with the highest need. Over $800,000 went to the Georgia Cancer Control Consortium, CORE, and then the 5 regional cancer coalitions across the state. And then also $50,000 for the Grady Infectious Disease Program to work with patients with HIV and AIDS, and $215,000 to improve hepatitis C surveillance and testing statewide. So, you know, there's a lot of things I think that we can be proud about. And we're all working to be sure that we have the health care providers in this and the facilities in the state, as was pointed out with your hospitals and our health care providers. If we don't pay our health care providers a reasonable fee for what the service that they perform, they cannot continue to serve us. So we've got to balance that out with it too. We have made and are making progress in increasing access to health care, and I think we're doing it in a responsible manner with the funds we have available to work with. And we have more to do. And I think that we all can agree on that. And at this time, are there any other comments or questions from anybody on the committee? Representative Stevens has a question.
This one's good. Thank you, Mr. Chairman. I just wanted to follow up, and I appreciate Representative Trammell, the minority leader, coming and bringing these issues to the forefront. The Some of you may not know we soundly defeated a tobacco product that was on the floor, but I would not be surprised that we don't see that again. In an effort to raise the tobacco tax to something that is equal to our surrounding states, we're the lowest in the South. And in my mind, and I think most of yours, we're subsidizing health care billions of dollars a year as a result of the disease, all the diseases that tobacco products bring. We have an opportunity, I think, in the next 4 days, because I believe you're going to see it again, to finally come up with our surrounding states, some of them, to make it so we can draw down those federal dollars to plug the holes. Every year we come back and backfill hundreds of millions of dollars in our Medicaid funding. But here's a perfect opportunity, and I believe you're going to see it, for us to raise the tobacco tax up to our surrounding states. We're 37 cents, and the next lowest is North Carolina at 45. I would suggest South Carolina, which did theirs a couple of years ago, so that we can plug the hole in the current Medicaid shortfall that we have, so that we can better treat our those uninsured. And with that, thank you, Mr. Chairman.
Thank you. Representative Leader Trammell, any other closing comments as we wrap this up?
Thank you, Mr. Chairman. If I might, I want to share with the committee a communication, and I'll read a portion of this. I mean, we've talked about the facts and the figures, but at the end of the day, you know, behind every one of these numbers that is a person. And this is an email I got in my first term in the legislature after I'd given a talk about Medicaid, and an article ran in the LaGrange paper. I just want to read a little bit. Young woman, and these are her words, and this is how I would like to close my comments. I'm so frustrated on this state. I am single, 36, with no children. I have narcolepsy, and until recently worked part-time, no health insurance, but because my health has gotten worse, I wound up having to leave. I see a sleep specialist, but honestly, I don't get to pay him. I just keep working up essentially a tab with the hospital he works through. I can't see a regular doctor for health care because then I'd have to self-pay, and I just can't afford it. So anything not related to narcolepsy, I never get to check. I take 2 medicines, Dexedrine and Xyrem. Dexedrine is a generic and older distant cousin of Adderall. It's old and there's no patient assistance. It runs me $200 a month. It's had months they've had shortages. I've been getting it at the same pharmacy for three years now, but even occasionally they don't receive their order. It's gone up about 3 times in 5 years or so. It's my lifeline. Without it, I can't function at all. The other medicine I take is Xyrem, and it runs $6,000 or $7,000 a month. No typo. I used to get it through a coupon program for $35. It ended in February. At first I did without it, then my doctor referred me to patient assistance. Seriously, who can get a script $7,000 out of pocket? And I have to go through a patient advocacy foundation to see if they can help, which ironically, without any ins and outs and such on my end, they can't, and then they will bounce me back to the makers of Xyrem. I've called them time and time again and left voicemail. They're swamped, and I'm still waiting. The Xyrem people say they can't do anything until they hear back from them. It's been maddening to say the least. I know I've rambled and told you a sob story you may not be interested in, but this is the upsetting part. I have worked and worked since I was 16. It's been full and part-time, but until now, I have always had a job. I never wanted to apply for disability because I didn't want to live on minimum wage my whole life. I pay taxes, albeit not much, but I pay sales tax too. I'll try my best to be productive, and it is maddening and heartbreaking to think my taxes could be paying for some murderer doing life to have health care, albeit not necessarily top-notch, but still considered for a prisoner a basic right. Why is this? Why is a prisoner considered a more valuable life than mine? Should I rob a bank and then obtain my Xyrem? It's just not right. Mr. Chairman, it's hard to answer an email like that. Thank you for your time, Mr. Chairman and members of the committee, and I look forward to working together.
Thank you, Leader Trammell, and certainly I think we all know that we have more to do, even though we've made a lot of progress, and albeit, as you say, it's slow and we're not where we want to be, and it is a complicated issue. I hope we'll all continue to work together, both sides of the aisles, to come up with solutions that will benefit all the citizens of Georgia. Thank you all very much, and this meeting is adjourned.